This is a lot for one pharmacy who's got patients coming in and out the door to kind of keep up with and to hold themselves accountable. If only there was some kind of group that they could join, some kind of group that maybe had an acronym as the title. Are there any groups that may assist in this that you could think of?
Yeah, it's coming to mind. I may need a minute to think about it. No, I think the acronym may be CPESN. So, yeah, it's crazy to see how much the CPSN movement has transitioned over the past few years. So when I was a resident at Moose, Joe and Ashley were traveling all over the country, grassroots effort to get this thing going and this really clinically enhanced services network. And so it's crazy now that it's almost 3,500 pharmacies. And what's really incredible, especially through the COVID pandemic and some of the flip the pharmacy work, is just seeing everybody coming together and figuring things out and sharing these best practices with one another because we're all in it for the same reason. Number one, to help out our communities and also provide a sustainable future while providing care for patients. And so it's really incredible. And I think that was one of the humbling parts about the pandemic is just seeing everybody come together and just for the greater good and sharing all these best practices. And here's a problem. How do we figure out? And people just standing up for the cause.
Yeah. So independent pharmacy really, is kind of at a point where they're being tapped on the shoulder by larger entities, saying, hey, can this group help? And this group of independent pharmacies absolutely can, but there needs to be, some collaboration for that to work for a bigger cause. And I think that's what's really so important about CPESN is being able to provide that kind of technical support and accountability. And, there's somebody in your state. So when you join CPESN, and how many states are there currently? Let me put you on the spot.
I know. I think you really are. 47, I believe.
Yeah, most states have a CPESN network, and so you have somebody there who is knowledgeable of, here's how we've seen other pharmacies do it in your state, and that collaboration is so important.
Yeah, it helps a lot, and it is just coming together to show the value as a whole group, and that's the challenge is that we're all named differently for a great reason, right? But then from a payer's view, they want to see us as CPSN or a network of pharmacies so that then they could sign a single contract or something like that to make it as easy as possible. And that's what we've done. And that's what's happened with the COVID-19 pandemic vaccine program is that if you didn't have X number of pharmacies, then you couldn't even sign up with the CDC to be involved with it. So I think that concept is just being brought to light even more these days.
Yeah, for sure. And like I said, the process of being paid for what you're doing really relies on having a process of quantifying and standardizing those efforts. And so we've seen that with, e-care plans where pharmacies are able to kind of say, hey, here's the playbook, right? Like, here's how we quantify that care. And then we're actually seeing pharmacies getting paid for what they do. So what's going on in that realm? I see all kinds of, every so often we have a new feature come out where CPESN has added a new payer to the network. What is CPES doing to facilitate pharmacies getting paid? How does that work?
Yeah, so there's currently 62 active payer programs across different regions and a few that are national programs. And so what CPSN is doing to help facilitate that is number one, share the value of what all the great stuff that these pharmacies are doing to the payer so that they understand this model because it's still very foreign to payers because they're used to working with the medical side of things. And so now they're thinking about pharmacies a lot differently. And after they get past that part, it becomes, okay, how do we implement this? So the pharmacies have great tools out there for documenting e-care plans if that's the route the payer is going, including you guys at Pioneer have a great e-care plan system for documentation of those things. And so what we do is develop out the implementation guides to say, here's what the payer wants, and here's how a stepwise approach of implementing this within your workflow. Some of these things are services that pharmacies are already doing, but then one of the newer ones that's focused on behavioral health screenings. All pharmacies may not be doing a depression or anxiety screening with their patients every single day. So we're trying to provide the resources to do this in an efficient manner, and then also document it so you can get paid for it, and then ultimately improve the patient's care. And so that way the contracts keep going and everything. And then, of course, we have great technology partners out there, PioneerRx being one of them, that are really helping pharmacies and stepping up to the table in order to make sure that they have the resources they need to submit the e-care plans or navigate a workflow issue. So everybody's coming together for the greater good here, which is nice.
Yeah, so there's that drive, to practice at the top of your license, right? Like, I want to be able to maximize my impact. I'm going to do, right up to what we're allowed. And as that ceiling is raised, that team is ready to move forward and fill that opportunity. And CPESN is really kind of pushing pharmacies in that same mindset. Push your pharmacy to the top of its license. And so that when you do get provider status in your state, when you do get that new payment model, when you do get those new opportunities, you're queued up and ready to roll. Thanks for listening to this clip from Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow PioneerRx on your preferred social media platform.